Select Medical Outpatient Rehabilitation. I have the pleasure of sitting here with Dr. James Andrews from the Andrews Institute and National Director for Select Medical. Dr. Andrews, thank you so much for your time. Wanted to talk a little bit about ACL injuries. It seems like it's become this really big epidemic. Do you mind kind of talking a little bit about that?
Well, it's certainly the number one sports injury, serious sports injury that we see as sports medicine physicians. Of course, they're more serious than that, but that's the one to the knee that we see so frequently. As a matter of fact, I think the local statistics now in the U.S. show there's somewhere between 250,000 to 300,000 ACL injuries a year in mature adult athletes.
That's amazing. So is there?
There's plenty to do, let's put it that way.
Is it more specific to one athlete or another athlete? Is it gender specific?
It's gender specific. Statistics show that females obviously have a higher rate of ACL injury in sports compared to males, and it varies from anywhere from 4 to 8 times. And of course, that depends on the sport too. The sport that's so predominant to females for ACL injury is female soccer.
Amazing.
And by the way, the younger the athlete involved in that adult type sport, the higher the incident, the younger you are, the more likely you are to tear your ACL.
It's amazing. So are there certain risk factors for females? Obviously being a female, but are there other risk factors that put athletes at risk for that?
Well, it's the genetic factors too, and development as an athlete. You know, females were really not involved heavily in athletics until Title IX came along. And since then, there's been a lot of development for female athletes, both for performance and strength and flexibility, and a lot of exercises that they're doing now to catch up with the males.
Sure.
I eventually would think that the incidence of ACL injuries in males versus female would probably be a 1-to-1 ratio at some time, but not in our generation. The females, number one, they didn't know how to jump and land, because they weren't doing that very much until Title IX brought the females into sports. And they would jump and land with a knock-knee deformity, which is internal rotation of their hips, weak hip abductors, and then valgus angles, which means they're knock-kneed and they land with their knees together, and then that angle causes a valgus force and a subluxation of the tibia on the femur and tears their anterior cruciate ligament just by the way they land from a jump. So that's been the big problem. And of course, there are all kinds of exercises now trying to teach them how to land and jump and develop the strength that they need to prevent that from happening.
That's great. And so are there things that we can do as athletic trainers, as coaches, as physical therapists to try to help prevent these, or is that something that we just have to live with?
Well, you don't have to live with it. The problem is getting everybody to do what's out there that we know will help. There are a number of systems now that are being taught in the summer months in a number of the metropolitan cities where they spend the whole summer teaching young boys and girls how to jump and land, develop the hip strength, the core strength that they need, which we know has already been proven to prevent injuries in these youth cutting sports, particularly in youth soccer. So we know it works. It's a matter now of just getting it done. I understand that you have a method too that you're developing to help prevent injuries, ACL injuries. Why don't you tell us a little bit about that?
Sure. So the program that we developed is called ACL Play It Safe.
ACL Play Safe.
Play It Safe.
That, if we had that, it would be great.
Yeah. Well, you know,
grandmother and granddaddy out there.
Well, and you know that's part of the challenge that we've had is how do you implement that into a practice, and part of that comes from a time perspective. Because we know from the research that if it goes over 20 minutes, that people just aren't going to do it. They're not going to be compliant with it. So one of the things that we do with that program is we actually do it at the end of their practice. And by doing that in the end of their practice, they're actually training in somewhat of a fatigue state. So that does two things for us. Number one is we don't have to do near that volume.
You're not going to cause injury, are you?
Right. No. Well, and the good thing about it is that we actually do it in a fatigue state, so they don't have to do near the volume.
Yeah.
They don't have to do the intensity of the exercise.
When you say fatigue, it worries me though.
Yeah, because they're already tired, and we're doing core training. We're not doing real ballistic movements or anything like that. We're doing more glute work, core work, and things like that. So two things. One is that we find that we don't have to do near the volume, so the time commitment is less. And then number two is that we train them in that fatigue state. So when they're actually playing in a fatigue state, it carries over more.
No kidding.
Yeah. So the other thing about it is one of the challenges that we find is how do you instruct somebody in that? Because if I instruct the coach who instructs the athletic trainer or whoever, and they instruct the athlete, then sometimes that instruction changes. So one of the things that we actually did is we developed a free app that's available on iOS and Android that they can download that has a video for every single exercise that we do as a part of that program. So that way the instruction stays the same.
Now, does this last, or is this something they have to continue to do in relationship to whatever sport they're playing?
Well, just like any strength training, you have to keep it up.
Yeah.
The strength. Yeah, the strength is going to fall off. What we find the best results are typically 3 times a week. So we don't do it on game days. We only do it on practice days, and it's something that we will actually do both in their on season as well as their off season.
If you were going to pick a specific sport, I know you would probably pick females, but what sports would you really think this is most important to incorporate in your practice? What sports?
To me, female soccer, female basketball, and volleyball, and lacrosse.
Huh? Lacrosse.
And lacrosse.
Yeah. We're seeing a lot of injuries now in lacrosse, both male and females. The one that really gets me though is female soccer, and these young girls are 13, 14 years old usually that tear their anterior cruciate. And when you tear an anterior cruciate when you're 13 or 14, the chances of you being able to play a college sport
drastically reduced.
Go way down. Also, the chance of you tearing your other knee or having further trouble if you do get to college is way up, multiple, like 8-fold, because you had an injury at such a young age. So it's not the best thing to happen. And as good as we are at fixing it, we still can't put it back together as good as the good Lord made it.
Well, with prevention programs, one of the things that we're finding too is that we're having a hard time getting people to buy into prevention. So one of the things that we're actually looking at is the performance impact. So we're actually seeing that when you actually do these same things, these same biomechanical factors that you talk about, that we see that put people at risk, we also find that when we improve those, it actually improves athletic performance.
Oh, of course. That's the thing you got to do. You got to trick the youth coaches and the parents and the players, but particularly the coaches and the parents. And maybe instead of talking about prevention exercises, we just rename them and call them performance exercises, because that's what you're really doing. You're improving their performance, and in the meantime, you're also preventing them from getting hurt.
Absolutely.
But they don't like prevention. That's not fancy enough for players and parents and youth coaches. The other thing that I'm seeing, and I know you're seeing it too, is the re-injury rate in youth sports relative to re-injuring the reconstructed ACL that's been operated on.
Well, and that's a big part, again, of what we're trying to do is we're actually taking this same program and applying it to our athletes as they return to play.
The thing that I'm seeing is everybody's in such a hurry to when can I return to my sport? When can I get back on the soccer field? And let me tell you, one thing about the young females, they're a lot more competitive in general than the young boy athletes are. And the youth, young female soccer players, if you can hold them out long enough to get well, you've really done something. And at 6 months after you do an ACL reconstruction, they're not well, believe me. And they're just dying to go back and start participating. And they go back at 6 months after an ACL reconstruction. Not only do they have a higher incidence to re-tear their graft that's just been operated on, but they've got about an equal chance of tearing the ACL in the other knee because she put so much stress on the so-called normal knee. For example, recent studies in the re-injury rate show, and parents should know this, you should wait at least 9 months before you allow anybody with an ACL reconstruction to return to their sport. At least 9 months. It's safer if you wait a full year. But the thing that we can remember, and parents can remember, for every month that they return to their sport short of 9 months, for example, at 8 months, there's a 5% chance that they can tear the graft, the knee that's been operated on, tear it up again, or tear the ACL in the other knee. And for every month short of 9 months, it's 5%. So if you come back at 6 months, there's at least a 15% incidence that they're going to tear up the operated knee or the unoperated knee and have to be reoperated on. And some statistics show that when they return at 6 months, there's about a 30%, and that's usually the young female soccer player, about a 30% chance they're going to have an injury.
Wow.
So you just cannot return before you mature and get all your muscle strength back and your performance back, and it's all a gradual step by step. But young female soccer players, man, they are really competitive.
Sure. Well, and so that leads me to the question: when should they go back to play? I know you said 9 months. Is that kind of the standard now?
That's
Is it
the
9
standard.
months? 9 months.
I don't know if that's the standard or not, but you talk to orthopedic surgeons that are also dads, mothers, that's what we say, and that's what we recommend, but that's getting them to follow your advice isn't always
Sure.
what happens. And they're really better off to wait a whole year before they go back. Then you know they're really mature and got the best chance of going on with their knee without further injury.
Right. So if there was 2 or 3 take-homes related to ACLs, what would we say as far as how do we prevent them? And
Well, don't play any sport year-round. That's just common sense, and that's related to year-round fatigue. You know, the more times you practice, the more games you play per year, the more chances you've got of getting hurt, right? So be a sports sampler and develop both sides of your body and give your body a chance to rest, for example, from soccer, and play softball or swim or do some other sport. Be a sports sampler until you're about a senior in high school. And the other thing is you need to make sure that your kids are involved in some type of preventative program or performance program like that you're developing, and they're available in the community. So look it up and get involved in those because they do help prevent injury. The statistics show in the studies that have been done on these preventative programs that they markedly decrease the rate of tearing ACL.